Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Have you ever suffered a type of pain in any part of your body that never seems to go away, despite taking numerous medications? Are you the type that experiences chronic back pains due to oversitting? Or maybe you have discomfort in your knees or legs after overstanding or walking? Did you know that even without medication, without the painkillers such as the diclofenacs and the likes, you can still manage that pain? Please welcome with me in studio a sports therapist, Mr. Sina Ismail from Activate Body Therapy Clinic, to tell us more about how we can control pain without the need of pain medications. You're most welcome, Mr. Sina.
Thank you.
And joining us is a special guest, Miss Jolie, to tell us about her experience with pains, with these chronic pains. Despite taking numerous medications, she doesn't seem to get relief. How has she been able to overcome this problem? So you're most welcome, Miss Jolie.
Thank you.
Yes, and I am your host again for the evening, Dr. Darius Sawachi. So we can start off with telling the viewers what your story has been with these pains.
Okay. I have had pain for the past 4 months, really.
Okay.
And it was something simple. It was in my knee. And I think maybe the way I was doing gym, certain exercises, with time the pain became intense, chronic, yeah?
Okay.
And I was taking medication. I was doing the painkillers. Every time I wanted to go for a run, my knee would hurt. So I actually went to a hospital and I did the scans and I was told that I needed to do surgery.
Oh,
yeah.
Okay.
But I was not up for surgery. No, I was
surgery
not okay.
was out of the way for you.
Yes.
You were like, that is a no-go area.
Yeah, I was like, maybe the body can heal naturally. So being a .com kind of person, I was on the internet and I was Googling, and then I found that there's something called sports therapy. Then I was like, then in Uganda, I was surprised that there was someone who does sports therapy.
Okay.
And that's how I was able to go to Dr. Sina, to his clinic, Activate Body Therapy. And I met Dr. Sina, and he promised me that I would heal.
Wow.
In all honesty, I thought I wouldn't, because after hearing a bit of surgery, I wasn't sure.
Okay, but I want to understand now the impact of this pain. How did it affect your life?
Whenever I would sit for long, as if my knee would lock, you know, that feeling, yeah? When it came to running, I couldn't run anymore. So I couldn't do my normal physical exercises, the way my life was. And I travel long distances, so after driving a long distance, my knee would hurt.
Wow.
Even sleeping actually in the morning, because
was not a problem.
every time I would rest the leg in a particular position, in the morning it has looked as if. So my life was a bit frustrating, really.
Yeah, so Dr. Sina, how did you handle Miss Jolie's case?
So the first thing immediately, I was to do some assessment. You remember?
Yes.
So I got her to lie on the couch, got the knee, so I flexed the knee. So basically I bent the knee and then straightened the knee and said, do you feel any pain? And she said to me, not really, I don't feel pain. Do you feel any locking? And she said, no, I don't feel any locking. So then after that, I started working on the muscles, try to find alignment of the muscles, how the muscles are structured. So I tried to feel all the muscles. So when I felt the muscles, she was very tight. Everywhere was pain.
Yeah.
And we even went through the back, we tested the shoulders, we tested everything. And I come up to the conclusion that, Jolie, you basically got discomfort, which is muscular pain.
Muscle pain.
Yeah.
So she didn't need an operation at that point.
Yeah, so I said to her, I don't think you're going to need an operation. I said, however, if you think you do, try to go for second scan, just to make sure, or I can work on you. And then she goes, you can work on me. So she gave me that.
Okay, so with your permission, if you'd allow, that he can demonstrate exactly what it feels like to be in a consultation with a sports therapist and what treatments they might administer. Is that
Okay.
okay?
That's fine.
All right. Yes.
Okay. So if you can lie down on your back, so when I lay her in this position, she won't be able to put any weight on the knee.
Okay.
So what we did, we bent her knee, and I asked Jolie, do you feel any pain? She said no. I said, okay, so if you can lift your foot in this position, do you feel knee pain? She said no. Then I said, okay, you can straighten the knee, no pain, okay. I said, can we do some rotation? Do you feel any knee pain? No. So then immediately I knew it must be muscle alignment. So I started checking all these muscles around the hip, checking these muscles, checking the muscles around below the knee, and also I checked the back as well. So I did the whole assessment on the body.
Okay.
The
So
muscle.
how did you know? How did you know that the muscles of the knee were not aligned?
Aligned.
Yes.
Because I palpated. So basically I press. So if I do this, if you're in pain, you feel the pain.
Okay. When
Okay.
you're moving
When
the
I'm
muscles.
moving, when I'm moving the muscle, just feeling the muscle in this position, you can feel the pain. So she
Do
immediately.
you feel any pain, Jolie?
No, but that time,
At that time I was screaming.
it was, yeah, it was very, it was
Even
terrible.
just to put pressure here,
Yeah.
this position here, she'll feel pain. Even on the arms, so even on the feet, everywhere, even on the back. So I said immediately, once I finished the assessments, I sat Jolie down and I said, look, we're going to have to look at the body as a whole. So there's no point of me fixing the knee because everything is connected. So what I did, I worked on it, which is slightly sports therapy. It's more applying more pressure onto the muscle, try to loosen out the muscle. So it's slightly discomfort, but the way we work, or the way I work, I try to make sure I work with the patient to make sure he's able to take the pain, the level of the pain. If it's too severe and the client guides me and says this is too much, I tend to lower the pain. So then we work on that because we've got stages.
People might think the treatment you're talking about, loosening the muscles, is the same as massage. Are they the same?
They're kind of similar, but one's more intense. One is you apply more pressure.
Okay.
So this one, so if I was to apply more pressure, there's some people scream, you know, just basically just causes a little bit of discomfort, but it gets better.
It gets better. All right.
You get the oil, which is a lot, it's got inside. So we put on our hand, so we work on the area. By this one, by the time you finish, so you can see.
It quickly enters
Yeah.
the skin.
Yes, so
Okay.
you can see from here. So we worked on the knee in this format.
Do these oils, can they enter the bones
Yeah, they
and
go
the
into the
joints?
muscle, so they absorb into the body.
Into the body?
Yes.
Any side effects? You know, people are very concerned these
No,
days
no,
about
there's-
side effects.
No, there isn't any side effects.
Okay.
Yeah, so it's just there's no side effects to it.
Awesome.
And it doesn't cause any itching, it doesn't. And if you've used other oils, sometimes they cause itching, so it's discomfort, and sometimes it can cause a rash. But this has not. I've used it for over 15 years,
Awesome.
so it hasn't got. But also in terms of like when you're working on this kind of treatment, the reason why it's different to relaxation or massage that you described, this one involves following the muscle structure. You have to know the muscles, you have to know the bones, and also you have to know injuries.
Yeah, so we learned that certain types of activities we do, like the physical sports, can inflict injuries on the joints and the muscles of your legs or in the hands. So we want to learn from Jolie. What take-home message, what advice can you give people? You know, people these days are so interested in keeping fit. They want to lift weights and, you know, go for marathons. What advice can you give them?
Yeah, from a personal experience, it's very key to have the right posture in the gym when you're doing any form of exercise. You have to make sure that you're not weighing your body down. You know, some people carry their weights and they weigh their knees down. Yeah, and then if you have pain, do not hesitate. Yeah, pain is an indication of something serious.
Okay.
Any slight pain, please consult the therapist or anyone.
Yes, so so if someone is in the gym or someone is doing sports, you know, or jogging, running, and they feel some kind of pain, even if it's little, they shouldn't take it lightly.
Yeah, they shouldn't.
Okay.
Yeah.
All right. So, and Mr. Sin, what would happen if they take it lightly?
If they take it lightly, it's just because normally the pain starts, you get a warning sign. And the more you leave it, you ignore it, the worse it gets. And then before you know it, it's turned into chronic pain. And if it's left untreated again, and you live with it, then you're going to have injuries, which can lead to tear. And that tear can lead to operation.
Okay. So does gym bring about chronic pain? More about that coming shortly after the break.
You are watching the Doctalk Show.